Good afternoon. Well, at least it's afternoon where I am, and afternoon where our guest today, Scott Silverstine, is. Not only is Scott a guest, if you are a member of our Dreaming with Entrepreneurs in Google Plus community, as almost 1,400 of you are, you'll know that Scott is a very big contributor to the group. Almost once a week, isn't it, Scott? You'll post something out there.
Yeah, I'll post something a little bit, little post here and there to get something going.
But we have a different kind of conversation that Scott and I are going to have today, and he is going to share a little bit about something very, very, very personal that has gone on in his life. I'm going to, in a moment here, going to share something that is going on in my life, and they tie together. And I guess, well, first I have to thank Scott Silverstine for taking time out of his schedule to share something that I know he's very, very passionate about, because Scott's a good friend, and we hang out a lot together. And I know, because I've gone through has it been 3 months now, Scott?
Since what?
Well, you had your surgery about 3 months ago.
Oh no, I'm 6 months out of that.
Out of this already? It's 6 months out of the surgery?
Oh yeah, can you believe it?
6 months already?
Yes.
Oh my goodness. Well, but
David, when you're having fun, time flies.
I'm 6 months. Well, and we've been talking about this since your discovery of it was about 3 months prior to that. So have we been talking about this for 9 months now?
Yeah.
Oh my goodness.
Yeah.
We're coming up on our first anniversary on a discussion about prostates and prostate cancer. Oh my goodness. It's unbelievable. Wow.
It is unbelievable.
Let's get into what it's all about. September, as Scott shared with me last week, is Prostate Awareness Month.
Prostate Cancer Awareness Month.
Prostate Cancer Awareness Month. I'm sorry about leaving the word cancer out. And
I know for some men it's really hard to put that in there.
Well, no, it's not hard. It's cancer. It's a strange animal, and it becomes even stranger when the percentage of folks in the world have to deal with cancer on a very personal level because they have it, or because a loved one or a friend is going through whatever it is that they're going through as far as cancer goes. We all have in our lives some identification with cancer, or most of us do. I mean, just the numbers speak to themselves. And it is Prostate Cancer Awareness Month, and it's very strange. Last week, Scott told me, he said, David, I'm going to be doing a BLAB this coming Tuesday?
Yes, Tuesday at noon.
Tuesday at noon. Wow, do we say in honor of, or in celebration of, in recognition of?
It was actually in response to Prostate Cancer Awareness Month.
No. But I meant, are you doing the BLAB to celebrate it, to share, to just create awareness? And it's once again, it's that whole thing about cancer. Wow, within a 24-hour period. And I can't remember if it was before or after Scott told me about it. I said, well, we're going to do an HOA. I want to do an HOA on it to help you market the concept, market the BLAB, so that more people can come and learn. That's what it's all about. Awareness, learning. I learned in a 24-hour period of having this discussion with Scott last week that my PSA, and Scott will explain to you a little bit about that, my personal PSA is a 7. Last Tuesday or Thursday, I can't remember which day it was, I had a physical my annual physical with my doctor. I'm 66 years old, and I made the decision on my 65th birthday because of not coincidentally, but it was also the year that I I got my Medicare insurance, and it's the first time in 20 years that I've had decent health insurance. I decided every year around that time I was going to have a physical. And as we get older, it's more important that we have those physicals because things happen as we age. I have some other issues going on with other parts of my body, but my doctor looked at the last time I had a physical, and he saw the different results of the blood tests that were done. And of all the tests, and he said, David, your cholesterol isn't too bad. We don't even need to retest that right now. But you must, it's my recommendation that you get a PSA, which is a reading, and Scott will explain that, of your prostate and what is going on with your prostate. It's a very controversial thing. There's a lot of controversy about it, and he'll explain that also. But I went, my doctor gave me a prescription to get this blood drawn. Literally went across that hall that day. And within 24 hours, I learned that my PSA number went from 4, which is, my doctor explained last year, the 4 was at the upper level of being normal. So it was a high level of being normal, to a 7, and increased 75% in it was actually longer than a year, it was about 18 months. Well, I talked to Scott about it right away. And of course I said to my doctor, are you concerned with that number? And he said, yes, I am concerned. I'm going to refer you to a urologist, and we'll go from there. So here's the segue into Scott. Scott, thank you once again for taking your time. Educate us a little bit about some of the stuff I've just talked about, and what's going to happen, and what we need to be thinking about, and about your BLAB on Tuesday.
David, thanks a lot for giving me this opportunity and platform to share my story, and to, one of the things since I met you a number of years ago, and David and I are, I would say, virtual friends. We hang out. We have never met. We've never physically met, but our chemistry is such that we become friends. And we
both have beards. I have less hair.
Our kids have the same names.
We had known each other for 2 years before we realized that the names of Scott's children are the same names of my children. How off the charts is that one?
And I still have to know. I still want to know if your American Express account number is the same. So if I can use that, it might be helpful.
Don't worry about that, because it doesn't exist. There is no American Express card. I'm not much of a credit card person, to be honest with you.
Yeah, my story, by the way, began with respect to prostate cancer, began back in November of 2013. And I, like David, found that my PSA level was elevated.
Now, was it an accident? Was it something on, what was the event, or what happened that you discovered that was the situation?
I went in for my annual physical.
An annual physical, just like I did. Okay.
And I knew that my father had a prostate cancer, and I also knew that he was diagnosed with prostate cancer at the age that I was. So one of the things that I requested that my doctor do, and he had always did the PSA test every time I came in, but I made sure this time he gave me a PSA. And
Why is it controversial? I mentioned that. Explain, please, Scott, why it's a controversial test.
well, just because you have a high PSA doesn't mean that you have a malignant situation. And the only way you can really uh, determine that you have a malignant situation is to go in with the needle biopsy. That alone I think it has a higher mortality than a prostatectomy. So it's serious. When your doctor says you need to be evaluated, it's a serious situation that you're in, because you're subjecting yourself to a invasive procedure where they go in through your rectum with a needle and they take 12 core samples of your prostate gland, which is only about the size of a walnut. So, so that's what happened to me. I had this elevated PSA, and I went to a urologist. He gave
Excuse me, Scott. What? Just for information, what was your number on that particular one?
Yes, I was in the my PSA always ran in the upper threes, and then when I found out that I was elevated, I was like 6'5", and they said you got to get evaluated. So, but it's not high. 6'5" is not high. It's elevated, and it doesn't mean that you have prostate cancer. And the other point, there are no symptoms for prostate cancer. And it's usually slow growing. And most men that find out about it are in their mid 60s. And a lot of men die and they don't even know that they have prostate cancer. They die from some other cause. So I go in for the biopsy, and I was informed that I had prostate cancer that needed treated, and I went and did the treatment, and now which was a prostatectomy.
Let me step back for a moment too and share some wonderful information that you were blessed in being able to deal with your situation with one of the finest urologists, knowledgeable, academically accepted urologists in the country. You were blessed to be able to be exposed to that.
Yeah, what happened, specifically what happened, and this goes for people, you don't want to wait and you don't want to put off taking care of problems like this. And when I first found out that my PSA was elevated, I was offered an appointment at a local medical center, and I'm not going to mention any names, but they offered me an appointment to see a nurse practitioner in the urology department. I would have had to have waited 4 months. Now, I don't know whether that's a result of Obamacare or what, but 4 months to me, knowing that I had the potential of a prostate cancer, was not acceptable. Well, the next day after I discussed this with my wife, and she also agreed that was just not acceptable, that I called Johns Hopkins. I'm fortunate to live about an hour and a half from Johns Hopkins, and I called the esteemed radiology clinic, the Brady Radiology Clinic there. It's where they actually discovered and perfected the technique for nerve-sparing prostatectomy surgery. And just by the draw, they got in to see Dr. Alan Parton, who is the chair of the department, and he is truly a renowned surgeon and known throughout the entire urology community. And I got lucky. I got lucky. I got to see the best. I went to the best. I got into the best, and he said that my condition, I needed treated, and there was no need to panic. So if anybody has a diagnosis of prostate cancer, usually there's no need to panic, because the PSA, even though it may not be as accurate as it could be, maybe it could be more accurate, it could be more correlate to the disease, but it does give doctors an indication that it's time to evaluate. And I had my prostatectomy taken out in the beginning of February of this year, and for the next 2 years, I need to take a PSA exam. That is the protein prostate cells create, and as long as it's not detectable, I'm in good shape.
What do you mean it's not detectable? There's going to be a number. Oh, that the cancer is not detectable.
Yeah, they can only detect such a small unit of PSA. When the lab report comes back and says undetectable, it means they can't detect any prostate cancer in you. I believe there is a percentage of prostate cancer that will grow back. So that's why you want to keep checking your PSA levels. So if it does start to grow back, you would want to go in for more treatment. And there's a lot of treatment today. There's a lot of drugs. They can keep folks alive, living good lives with prostate cancer. And the technology and the experimental technology is advancing on a daily basis.
I was with a gentleman yesterday. We were in a group and we had lunch and we drove home together. He had his prostate removed 15 years ago, and there is some reoccurrence, and so he's kind of dealing. He's not alarmed with the reoccurrence. It happens. So let me ask you this question, Scott. What is your PSA today, or do you know it, or does it go? Does the number drop back to a lower number, and they can then measure if it's increasing that something's going on, or how does that work?
Well, today my PSA is undetectable, and that's been the case for the last 6 months. So every 3 months I go in for the blood test. It comes back. It's undetectable. So it's less than, how the lab phrases is, it's less than 0.1, and that is in the urology industry looks at that number and says that you don't have any PSA in you. Once it starts to rise, then they get concerned that there may be some activity. In any event, being at Johns Hopkins, one of the things that I noticed that just about all the urologists had Twitter accounts. And I started following these guys, and not only they had Twitter accounts, but their other colleagues at other major medical centers throughout the United States had Twitter accounts. And then when BLAB, the BLAB platform started to get pretty popular, I tweeted out to a number of these urologists that anybody game for prostate cancer BLAB in response to Prostate Cancer Awareness Month. And just about immediately, Dr. Jamin Bramblebot from Orlando, who is a robotic surgeon and he's a urologist, he said, let's make it happen. And I created the BLAB, and the BLAB is scheduled for Tuesday at noon. And if I just posted the link over in the chat. So if
why don't you put it in the event stream also? Because I'm going to be distributing the event stream.
I'm not sure what you mean by the events.
The original.
Oh, in the yes, I can do that.
Put it in there.
I did that in my post. The link is in the post.
Okay, because I'm going to be marketing that between now and Tuesday.
Yeah, so I happen to believe that it's important for men, and including women that are affected, because it doesn't just affect men; it affects women. It affects your family. And if you know people that are affected, I think it's important to blab. I think it's important to talk. And we're fortunate to have on this blab on Tuesday, Dr. Bram Bott. He is an expert on men's health. He's been featured on CNN and Fox and Yahoo Health. And he's going to take the time out of his busy day to communicate with folks that do have an interest in prostate cancer.
And what time is that again, Scott, on Tuesday?
That's at noon Eastern Standard Time. In order to participate, you need to come in with your Twitter account. But if you don't have a Twitter account, you can sit there and lurk and absorb the conversation.
Well, as you know, I signed up for it and I'm subscribed, so I will be there viewing. Needless to say, it's something. Well, just there's two aspects here. There's the aspect of just, part of what I do is getting information out into the public about entrepreneurship and small business. It just so happens that because you, my friend, have gone through this experience, and I've had other friends along the way that have had to deal with this, and the fact that I had a number that's on the increase, and I'm now going to go and go to a urologist and get a consultation with them. So I want to thank you for taking time, Scott, and we're obligated now to tell as many folks and make as many folks aware as we possibly can about Prostate Cancer Awareness Month. The next time we'll see you, hopefully, will be Tuesday at noon, and I'm sure Scott will record the blab so that it'll be archived and we'll be able to distribute that also.
David, thank you very much for making the platform available. As you said, you've always say it, you believe that you've succeeded when there is one person that you make a difference with.
Yeah, that's all that it takes. One person a day, that's all it takes, and everything moves forward.
Yes, sir.
Lashana Tova Tika Tevu to you, Scott.
And happy New Year. 5776, right?
5776. And we'll see you the next time, which may very well be the best time.